Minnesota's top board-certified plastic surgeon and former chief resident at the Johns Hopkins Hospital has expanded its practice here in Miami. Dr. Chopra with Chopra Plastic Surgery has perfected reconstructive surgery for facial and orbital surgeries. Thank you so much for joining us here today.
Thank you so much, Annabelle. It's been a pleasure to be here. We're all moved in at our new Coral Gables office, and I can't wait to work with the community here. So,
thank you so much. I am your host, Annabelle, live with A Day in Miami from Miami's Community News. Okay, so here we go. Let's get started.
Thanks.
Dr. Chopra, what inspired you to open a practice here in Miami?
You know, my team looked at a bunch of different cities when we were looking to expand the office that I have in Minnesota. And Miami immediately struck out because it has a vibrant city with a lot of energy. And beyond that, it already has a reputation for being an international hub for cosmetic surgery and reconstructive surgery. It's a city that respects aesthetics, it embraces beauty, and people here really value quality work. And so I think with our new office opening here in Coral Gables, we'll be able to join the other colleagues in plastic surgery that I have here in delivering that high quality work.
I agree with you. And as I mentioned in my introduction, you are a former chief resident of Johns Hopkins Hospital, which is so impressive. Tell me how your background sets you apart from other plastic surgeons in the area.
Absolutely. Well, there are other surgeons from Johns Hopkins who are my colleagues here, and it was a pleasure to train at Johns Hopkins. I got to work with amazing colleagues from other sister disciplines too, like orthopedic surgery, neurosurgery, dermatology, and ENT. And having that kind of collaboration with all the fields at the top level gives you a unique tool set to be able to deal with complicated aesthetic and reconstructive needs in the area. So I'm excited to bring that fund of knowledge and expertise to this market and really take things to the next level for my patients.
Absolutely. And your education, because we spoke about this before, you have a lot more schooling, correct, than other plastic surgeons. Now, not to talk down on other plastic surgeons, but education is key, and you have a lot more of that. Can you explain how many years of schooling you did?
Yeah, plastic surgery residency in the United States is anywhere from 6 to 10 years, depending on what route you take. And on top of that, fellowships, I personally value fellowship training. So I did an additional fellowship specializing in eyelids and neck lifts and facelifts. And then my time in Minneapolis was well spent doing hundreds and hundreds of facial procedures so that our craft is really perfected, and the procedures that I've invented can really help patients achieve their goals.
I love that. Okay, and now actually on that subject, can you elaborate on some of the services and procedures that you do offer at the Miami location and Minnesota if anyone's traveling?
Yeah.
So we'll pull up the website and you can start.
You know, as part of our consultation process, patients come in, we use some of the latest 3D modeling and imaging softwares to get an idea of where you're starting.
Okay.
And one of the procedures that I've invented is a neck lift that specializes in providing contours in younger patients with just a single incision under the neck. Through that, we're addressing all the deep structures such as the glands, the deep fat, the deep muscles. And if patients need a chin implant, we provide chin implantations. If they need buccal fat pad reduction for facial slimming, we're able to offer all of these solutions through hidden scars or sometimes even no externally visible scars. And to me, that's a game changer for the Miami market.
Yeah, that's very impressive. Okay, so on that subject, you mentioned neck lift. And I know that you specialize in that because your biggest key point is natural looking results. So the way that you operate on these patients is very different from other plastic surgeons. Yeah. So you pride yourself on natural looking results. We're going to pull up some before and after pictures, and you're going to guide us through your procedure.
Absolutely.
Okay.
Awesome.
So this is the before. Yep.
Right. So this was a young 41-year-old gentleman, actually very lean, very fit, but on his profile and from the front, he felt like he looked heavier than he was.
Okay.
So because of his young age, we were able to go through a single incision hidden under his chin, through which we cleaned out his neck, got him a perfect jawline. We added a small chin implant to give him a more masculinized look. I took out his buccal fat pads through 2 internal incisions inside the cheek. And if you look at the after picture, focusing on his neck and jawline,
wow,
you can see that the result is improved his neckline. and there's no scars around his ears, which was the traditional way of performing these surgeries.
Okay, yeah, that's very impressive. Completely changes the person's profile.
Yeah, and it's important to note that liposuction alone can never deliver these types of impactful, profound results. And in fact, liposuction alone in the neck can damage the skin quality if it's over aggressively done. So my indication for liposuction in a patient is pretty limited to patients with just fat right under the skin. But a lot of times, the issues that these patients have is a layer deeper, which people tend to miss.
Okay. And this is the female example that we're using, and this is her before.
Yeah, this is another lovely patient of mine. She's also an attorney in Minneapolis and a good friend of mine. So for her, we did a similar procedure. Instead of using a chin implant, though, we did facial fat transfer to her chin and her cheeks to give a more aesthetic, pretty look, just like filler. But then again, we also did the deep neck lift using just that tiny incision hidden under her chin. So we can show that post-op picture here.
Yeah, let's do the post. Wow, look at that.
The impact that makes, but it's also the softening of the contours in the cheek and chin with the injection of patient's own fat instead of filler.
Right. And I mean, it just completely transformed the person. It's still her. Yeah. She's a beautiful person, but it just, completely redefines the individual.
I love patients when, I love the impact it makes, and when they send me selfies and tell me how it's really changed their lives. So to me, that's the biggest compliment.
Absolutely. Yeah. Anybody who does work on me, I blast them on social media. Right. So doctor, get ready for that. Okay. So any individual that's interested in doing any of your procedures, you have something called Envision Consultation. Absolutely. Talk to us about that.
So the Envision's consultation process is unique because using our 3D imaging softwares, we're able to allow patients to truly envision what the outcome would be. Impressive. So we use the 3D vector camera system through Canfield. So patients come in, they know exactly where they're starting, and then they get an idea of what can be achieved surgically, what can be achieved non-surgically. If we just do liposuction, what might you get? If we do my special neck lift, what might you get? And so this allows patients to make truly informed decisions rather than if you go to a provider who can only do injections, then you don't know what else could be done. But because we offer the full spectrum of treatments from non-invasive injections to full facelift, neck lift, everything, we're able to give you a customized treatment plan. And that's really the fundamental basis of the Envision's consultation.
I like that. That makes a lot of sense. And congratulations to your pending patent, right? Which is an efficient way to fat transfer, right?
Yep.
For procedures during surgery. And it's called the lipo shot.
Yes.
So we'll put up a picture of the lipo shot, and you could tell us a little bit about that.
Absolutely. Yeah, the lipo shot is truly poised to be a game changer in fat transfer for not only breast reconstruction, but cosmetic breast surgery and facial fat transfers. It's been a long road and would not have been possible without the help of my friends and colleagues at Vita Group, Jason Scherer and Richard Thompson, who've been the engineers and business people behind it. But this is a specialized system to harvest, purify, and inject fat back into the body, whether it's for enhancing breast size, improving contours after a lumpectomy for cancer, or facial fat transfers. Because for the longest time, we've recognized as plastic surgeons that fat is the difference between a good and a great outcome. But oftentimes it takes more time. The results were unpredictable, and this device is a single-use device that improves fat engraftment and also reduces the amount of time so that it's okay to do it. It's not adding an inordinate amount of time to the surgery.
Right. And it seems so simplistic, but it does wonders.
Yeah.
Right?
Those are the best solutions.
Yeah, I love that. And something I did want to mention is you're giving back to the community finally. And that's so wonderful. You're giving back to our combat veterans. You have donated facial reconstruction surgeries for combat wounded veterans. And that's so impressive. And what motivated you to do that?
It was an easy choice. I think that helping wounded veterans is something that it's not just a privilege, it's almost a requirement, I think, for me. These are people who have served our country so we can relax and enjoy life. However, oftentimes they're coming back with injuries or scars on their faces that are reminding them of their sacrifice. And so if we can make a similar sacrifice on our end to help them feel better and look in the mirror, it's a privilege for me to do so. And I also hope that by sharing the fact that we're doing it, it might encourage other colleagues in the area to help in whatever way, whatever skill set they have to help out. I think if we can all do our part, it'll make the world a better place.
Thank you so much, and we appreciate that. And my viewers know how dedicated I am to the military community.
Right.
So a heartfelt thank you to you.
Thank you.
Absolutely. So where can our viewers reach you? You can tell the camera.
Absolutely. If you are in any way interested in seeing us for a consultation, definitely check out our work on Instagram. It's Karan Chopra MD, or go to my website, drchopra.com, where you can request a consultation. We do them virtually as well as in person in our Coral Gables office, and I can't wait to see you.
Thank you, Dr. Chopra, with Chopra Plastic Surgery. We welcome you to Miami.
Thank you so much. Cheers.
Cheers. Thank you so much, and stay tuned for other stuff that the doctor has for you.
Appreciate it. Thanks.